Hi, I'm Neil O'Grady. I'm an osteopath, and what I'd like to do today is demonstrate to you a 1-minute cranial screen. So this is a screen for the cranial nerves. If any of these tests show some kind of dysfunction, you'll have to do a more detailed cranial examination of those particular nerves. So I remember the 12 cranial nerves using an acronym that goes something like this. On old Olympic towering tops, a Finn in German viewed some hops. So in the correct order, that would be olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory, and hypoglossal. That's the 12 cranial nerves. So what we're going to do is basically a 1-minute cranial screen. It might take a little bit longer because I'm just going to explain what I'm doing. So here I have a little container and I've got letters on it. And inside the container I've got something which has a kind of a smell, a recognizable smell, and will also make a noise. So here we go. So first thing I want to do is check the optic nerve. So first thing I'm doing, I'm about 10 feet away, we'll say, and I'm just rotating this, and I want you just to call out the letters if you can see them.
A, Z, U, R, T.
Very good. Okay, so you can read those. That's the optic nerve. Next I want to check the auditory nerve. So close your eyes for a second. I'm going to make a noise in one of your ears. Just tell me what it sounds like and which ear it is.
A shaking in my left ear.
Okay, so we've checked, and we can do that in both ears. That's the auditory nerve. And then I'm going to open the container. I'm going to say, just smell what's in the container and tell me what it is and if you can smell it.
Smells like coffee.
Okay, so that's the olfactory nerve, your sense of smell. All right. And the next one I want to do is I want to check the cranial nerves which are responsible for lateral and oblique movement of the eyes. So that would be the oculomotor, abducens, and trochlear nerve. So what I'll do is I'll stand back here like that, and I'll make a large H, and I'll just say, Jimmy, just keep your head exactly fixed and follow me with your eyes only. So, and I'll take over with this hand because it's a large H. And down, and from that I can see that he can follow that, he can move his eyes obliquely and laterally, so there are no issues with those particular nerves. The next thing we'll check then is the facial nerve. So I'm going to ask you to scrunch up your eyebrows, okay, and now blow out your cheeks and show your teeth. Okay, so that's the facial nerve. And then the next one I'm going to do is the trigeminal nerve. So open your mouth, okay, and now say ah. Okay, and drop, and you can close the mouth. And what I'm looking for when he says ah, as I'm looking for the glossopharyngeal nerve, he can speak. And I'm looking for the vagus nerve. I'm looking at the uvula, the little teardrop in the back of the throat. If there's a upper motor neuron lesion or there's some kind of dysfunction affecting the vagus nerve, the uvula can drift to one side. Okay, and then I'm going to ask him to stick out his tongue. So now I'm checking the glossopharyngeal nerve. So in somebody who's got dysfunction, you might have fasciculations like trembling of the tongue, or the tongue might drift to the side of dysfunction, and you can put the tongue back in. Okay. And lastly, what we've got to do is check the spinal accessory nerve. So the spinal accessory nerve is the cranial nerve responsible for shrugging your shoulders and turning your head, so your trapezius and your sternocleidomastoid. So just shrug your shoulders up into my hand. So he has the power to do that, and just rotate your head to the right, and then rotate your head to the left. So in this case, all of those, he can rotate his head and he can shrug his shoulders. So that, everybody, is a normal 1-minute cranial screen where there's no dysfunction. Like I said, if there is any dysfunction, we'll go into a more detailed cranial screen of those tests of those particular cranial nerves. That's for a later video. So if you like the video, please subscribe, and talk to you next time. So I remember the 12 I don't remember the 12